Karen speaking. I hope everyone enjoyed their lunch, and we now welcome to the stage our panel 3 speakers. And they'll be discussing research and data to shape an inclusive Queensland. So, on our panel this afternoon, please welcome Dr. Kelsey Chapman, who I've had the pleasure of working with, who's a research fellow, the Dignity Project, Inclusive Futures, Reimagining Disability at Griffith University. Kevin Cox, AM, Executive General Manager, Accessible Transport Network, Department of Transport and Main Roads, and Dr. Talitha Kingsmill, Research Fellow, Griffith University, and Seasonal Academic, Australian Catholic University. And online we have Professor Julian Trollaw, Director, National Centre of Excellence in Intellectual Disability Health. And we also joining Julian is member of the National Council for National Centre of Excellence, Donna Best. So the facilitator for this session is my friend Noreen Williams, who's a director on the QDM board. So thank you. I'm sure this will be a great session.
Thank you. Thanks, Karen. So for all of you, if any of you have been involved in education ever, you know that the first session after lunch on a Friday afternoon is the worst. So to help you all out, I'm giving you a little bit of visual happiness with my bright green shirt and my sunflower earrings. I am a short woman with Duck's disease, and I have short curly hair, and apart from my gorgeous green shirt, I'm wearing black pants and a bracelet that I made with my daughter that says stubborn on it, just to give you a bit of a sense there. So I guess before we start in with our panel, when we talk about the legacy from 2032 or even what the 2032 games mean for us, I am incredibly excited for all of you out there with any ounce of athletic ability and a little bit envious. As a phenomenally uncoordinated person, I'm particularly excited about the legacy. Okay. But to make good choices about making any kind of change, we need good information. Okay. So on that note, I'm going to start by asking our panel, how can research and data help us foster a Queensland that pushes the boundaries of what is possible, and how we learn and use innovation and research to drive change now and into the future, implementing disability reforms and realising the opportunities of Brisbane 2032. So I would like to invite the very lovely Dr. Kelsey Chapman to start by sharing her thoughts.
Thanks, Noreen, and thank you to everyone for this opportunity, especially QDN and Minister Mullen for having me. I want to start off by acknowledging the traditional owners of the land on which we meet today and just pay my respects to their wisdom that forms so much of the storytelling and data that we all work with, and pay my respects to elders past, present, emerging, and any First Nations people here today. My image description is I'm a young-ish. I think I might be the youngest panelist, so that's good. Something to take home. Woman, I have long reddish-brown hair that's curly, and I'm wearing a bright blue suit and black shirt. I'm also American, so in case you haven't noticed that, you might hear that. And today I am really lucky to, follow on from the panelists who have already spoken and build on some of their key thoughts. Auntie Seema shared about the importance of sharing our reality and our day-to-day, and Dr. Boyce about collecting diverse ideas and diverse perspectives. Luke shared about including people who aren't in the room and making sure that we hear from them. And these are foundations of research and innovation that's really going to push the boundaries in Queensland. I'm also excited and honored to announce the release of the Voice of Queenslanders with Disability 2024 report. So you should all have a QR code that you can scan on your table. I think there's about 2 per table. And it's also available online. And I think there's some small amount of copies in the room. And the Voice of Queenslanders report is just one example of the way that the department, QDN, and of course me from Griffith University and our team are already using data to push boundaries. So it's one of my great honors to work on this project, which is really about collecting data, the types of data that Auntie Seema, Luke, and Dr. Boyce spoke about. Lived experience data from people with disability, families and carers, and the organizations that support them around Queensland. In the past 2 years, we've collected data from over 1,000 people, and that has given us the opportunity to contribute to the research landscape and the innovation landscape in 5 key ways. So I'm going to talk about 5 of them very briefly. And those are uncovering insights and creating understanding, evidence-based decision-making, monitoring and evaluation, empowering community perspectives, and iteration and innovation. And I think together these 5 aspects are what's going to really lead Queensland in both the legacy but also the disability reform. So in terms of uncovering insights and creating understanding, this survey and the report is an opportunity to hear directly from people with disability and to feed into government. It's boundary pushing in both its frequency and its scope. Queensland is the only state that is collecting this type of data annually across the 7 outcome areas of the Queensland State Plan and Australia's Disability Strategy. So we're the only state monitoring what I like to call the micro trends, monitoring and evaluation, micro trends that are appearing year on year. So for example, this year, some of the things that people shared with us were that we need better protection for assistance animals and to uphold those rights for people who use assistance animals in the community. We heard from people about the real impact that the rising cost of living was having on their lives and the financial insecurity that it was creating. We also heard a lot about negative education experiences and the kind of disparate experience that people are having. We heard from families and carers that they need more support and that they need both financial and mental health support in order to better fulfill their informal support role. And these are all things that were touched on in the 2023 report, but that really increased in this groundswell of data in the 2024 report. And what that means is that Queensland is able to monitor and evaluate our progress towards social inclusion and towards this idea of a really inclusive 2032 and 2042. It also means that we can make evidence-based decisions on a whole of government scale. So the whole of government has access to this really unique data set that can then transform the decisions they make around reform and the investments that they make around that reform piece that's driven by the community voice, which I think is critical for any innovation and change. I think the other key thing for me is the fact that this annual collection of data means that we can support the implementation of that disability reform framework and get almost real time, not quite real time, but as close to real time evidence as possible to support what's working, what's not working as well, and where are the real opportunities for innovation from the community. Some of the best parts of working on Voice of Queenslanders is the fact that we work with citizen scientists. So that's people with disability from the community who work with us to collect data from their community. And that's just one piece of research innovation that I think we can all take forward. So it both promotes employment and some economic opportunity for people with disability, but from a research perspective, it means we're collecting data from the people who aren't in the room today, particularly from regional and remote communities. We had almost 39% of our data set from those areas. And that means we're getting a varied perspective. One of the key things around empowering that community perspective is understanding that no one person's lived experience is the same. And so our approach to reform and our approach to legacy needs to be flexible so that it can impact both individuals and collective communities. I think the last piece before I get told I need to stop talking is around the legacy. And this, in the modern kind of legacy era of mega events, there's often monitoring and evaluation, and people with disability are often positioned in the legacy as part of the Paralympic Games. And one of my hopes for the innovation around this monitoring and evaluation period ahead of legacy, because we have Voice of Queenslanders, we can start looking at social inclusion now and have a really strong measure of how the Games impacts on social inclusion by 2042. It also means we can position people with disability as volunteers, as spectators, as community members for the Olympics, not just the Paralympics, and have that cross-community impact of this mega event that's going to have the potential to bring us all together and really have a true inclusive legacy. I think that's it.
Thank you, Kelsey. Thank you, Kelsey. And continuing in that vein of actively including people with disability and promoting co-design, Kevin, would you like to share your thoughts with us?
Yeah, thank you very much, and thanks to QDN and the government for giving me an opportunity. QDN has a catch cry, nothing about us without us. I'd just like to talk very briefly about its history. It came to life in, once again, the disability movement in the early 90s in South Africa by the South African Disabled Advocacy Movement. But its first origins were in the 1500s in Central Europe, where their political traditions. And in 1505, it was very much a catch cry of Polish citizens in developing their constitution, which I probably will not pronounce because I'm a boy from St George who drops me H's. It says Nihil Nehvi, which first transferred governing authority from the monarch to the parliament. So if we are authentic about imagining possibilities, shaping an inclusive Queensland, then we must address the structural root causes of the exclusion, the systematic exclusion of people with disability from everyday life in society, education, employment, housing, transport, health, and I think I said employment because I want 2 jobs. And that culture has been developed, as our First Nations people call it, institutional racism. For people with disability, it's institutional ableism. It has been people with power and authority who have told us stories about people with disabilities, that they have tried to define us, which have resulted in our exclusion. And it's a power of story through research that will help us reclaim our rights as citizens and to dismantle the structural barriers that need to be dismantled for us to participate every day where we live our lives with dignity. Co-design through lived experience and experiential learning must be central to all research methodologies if we are going to build an inclusive Queensland. TMR has learnt from its mistakes in the NGR debacle through co-design. And we have developed a relationship with QDN Engage where 10,000 of our staff, if they want to co-design, whether it's information, communication, major infrastructure, minor infrastructure, products, goods and services, they can have access to whoever they need with lived experience to provide input into shaping those outputs and outcomes of all of TMR's goods, services, products and information. Co-design is a conversation as a learning tool. The suggestion that conversation is a primary means of learning through dialogue. Individuals share their knowledge and experiences, which leads to mutual learning and understanding. This aligns well with the principles of adult education and experiential learning theories. It's discovery through conversation. It is proposed that conversational exchanges allow us to discover more about one another. Here, discovery refers not only to learning new information, but also understanding different perspectives and experiences, which is crucial for empathy and inclusive design mindsets and practices. There is a need for a safe space. A successful conversation, especially in co-design process, requires a safe space where we can be vulnerable. This means creating an environment where participants, I've gone back to the medical model, feel comfortable sharing their experience without fear of judgment or retribution, thus enabling open and honest communication. Navigating the learning cycle. This reference to navigation, the learning cycle, suggests a continual process of experiencing, thinking, acting, and reflecting. This mirrors the educational theorist David Kolb's experiential learning cycle. I'll just showcase some examples of our inclusive transport at work. The Dignity Project, which was led by the eminent Dr. Kelsey on my right. In 2020, we developed an accessibility and inclusion strategy, which was based in a human rights framework. We commissioned the Dignity Project in order to better understand the factors that contribute to dignified mobility experiences for customers with disabilities. The key findings were that people with disability define dignity in a range of ways relating to individual personal factors, community and environmental factors, and transport infrastructure and systems of factors. We also commissioned a cultural safety and inclusiveness of Aboriginal and Torres Strait Islanders employees at TMR. A research team from Griffith University was approached to identify the barriers and enablers to cultural safety at TMR, and to subsequently they developed a set of 24 recommendations which were all endorsed and will be implemented over the next few years. We've developed a Universal Design AV People Mover research project, this time with QUT. The 4-year project has developed, we're now in a I've got to cut this short because I've only got 30 seconds, a prototype model, and we've delivered papers in Germany, America, and other parts of Europe. And we are leading the world because we're designing for everybody, not just for people with mobility impairments. Because what triggered this question was when I read an article that claimed AV vehicles will liberate people with disabilities and older people. And I thought, if you can get in the bloody thing. And I forgot to describe myself. I'm young, 64. There's a great song about that. I wear glasses. I used to drive fast cars, now I've got no hair, a grey beard, and I'm in a wheelchair, and when I'm lying down, I'm 6 foot. The key insight is a quote from Jimmy Neil Smith, "What's your story?" We are all storytellers. We all live in a network of stories. There isn't a stronger connection between people than storytelling. The key action is for every one of you here to take concerted citizen action by telling your story to create a new space where we are all welcome and we all belong. Thank you.
Thank you, Kevin. Talitha, could I ask you to share with us your thoughts?
Thank you, Noreen. Can everybody hear me? I normally have a problem with the microphone, so that's good. Yes, Michelle's nodding. Thank you. I would like to begin by acknowledging our elders, past, present and emerging, and also acknowledge all of the people with disability that are here today, online, in the room, that have gone before us and truly are the people whose shoulders, that carry us with the work they've done to be here today. I would also like to describe myself, although I'm not sure how I follow your description there, Kevin, but look, I'm going to go with what most panellists have said today, and that is I'm middle-aged. I have brownish hair. I am often described as someone that always has a smile on their face, so that's a nice way to be described. And I have a black and cream jacket. I'd also like to say that I, first of all, thank QDN, who many of you know that I'm a big fan of QDN and a big part of QDN, and I'm so proud of what's happening here today. So I'd like to thank QDN for the invitation, thank the Minister and thank the Department of Child Safety, Seniors and Disability Services for this opportunity. I would also like to say how honoured I am to be sitting on this panel with the people that are here, and to say I recently had the wonderful honour to be on another panel with Kevin, and I would say that I feel very grounded as a panellist that follows Kevin, as someone that truly leads by example and truly epitomises and lives the very notion that we need to be at the forefront of leading, designing and being the solution to opening people's eyes and expanding horizons. So thank you for the invitation to be here today. Now, Amy, for my sake, is going to make sure she keeps me on time and hold it up very high, because I do have a vision disability, so I certainly won't see anything happening down here. So if you see a lovely lady in a purple jacket jumping up, that's what she's doing for my benefit. But look, I have the very great honour of being here today to speak in one of my roles, and that is as the research lead for the Queensland Disability Research Network. Kelsey and I do quite a bit of work together, because I will do a shout out there also to the Inclusive Futures team with Griffith University and Professor Elizabeth Kendall with all the wonderful work that she heads up. Today I'm talking about the Queensland Disability Research Network, and the question that I've been asked to answer first is just what is it? Because as we've heard today, there's lots of acronyms flying around and there's lots of happenings in this space. So just wanted to share with you that we are a unified disability research voice across Queensland. We're a cross-sectoral and cross-institutional alliance that was founded in May last year, so 2023. And the network is a network of disability researchers, of people with disability. We work with industry, we work with government, with peak disability organisations, citizen scientists, and I did make a note for myself after listening to the panel keynote there, that Wayne, the way he described entrepreneurs, I'm going to list that as definitely part of the description for our network, because when he described entrepreneurs as problem solvers, curious problem solvers and opportunity creators, very much we have lots of those people in the Queensland Disability Research Network. So I would add that as part of our membership. So we are focused as a network on ensuring relevant, meaningful, co-designed research. Really importantly, from scoping through to translation and dissemination. And as we've already heard from Kelsey and Kevin, that real authentic co-design. So we're not talking about a bit of fluff on the side and a bit of consultation or collaboration at the end, or ask for a bit of feedback once all the decisions have been made. It's that authentic co-design, which QDN espouses and lives so well and leads in that area. A focus very much for the network also is in developing research capacity in the sector. So that's in developing universities' researchers' capacity, in university students' research capacity in the disability area, citizen scientists, people with disability, and just in terms of, and when I say just, it's a really big thing, so I shouldn't use just, but in terms of the disability community and the wider community, in terms of looking at what is data literacy. So really understanding how we can use data to make difference, to push boundaries and to lead innovations. The network has a genuine commitment to improving the economic and social participation of people with disability. And we understand that that only happens when there are sustainable, collaborative relationships. And that's really how the network emerged in May last year. It was in answer to a demand that there was a real need for robust, authentic, impactful disability research. And for that to happen, you had to have key stakeholder representation, and there needed to be those community networks. So not just people that fly in and do a workshop, but actually have networks within the community. So we're talking rural, remote, regional, metropolitan. So the network was engaged by the Department of Child Safety, Seniors and Disability Services, and I see Max and a lot of the team there. We were engaged by the department in May this year to actually develop the department's inaugural disability research strategy. So that has been an amazing project to be involved in, and I'd really like to do a shout out to all of those people online and to people here today, who many of you were involved in the either on-site or online workshops that were hosted. So we had workshops across May and June. They were in Toowoomba, in Brisbane, Townsville, Cairns, other parts of far north Queensland as well. So in terms of those, they were real discernment, sharing insights, sharing possibilities. So that's an example of what QDRN is doing and where we see the future is at, having that unified Queensland disability research voice. How am I going for time? I've only got 1 minute. I'm sure I have Italian heritage because I speak so much, but I haven't covered enough. Michelle, I'm getting to the second question. Okay, 60 seconds, here we go. Key priorities for the Disability Research Network. In a nutshell, there are so many, and that really is reflective of the fact that the disability community is diverse. There are many, many needs. The spectrum of disability is so important that we represent it, and we've heard that from our speakers here today, right through from the visible to the invisible disabilities. So that's really something that is a priority for the network and for disability research. Co-designed, community-led projects, another real priority. Meaningful place-based data, that's coming through all the time. Can I also say intersectionality of disability research? That's another real focus there, and looking at very much disaggregating data to say where we do have those intersections, let's get some real data so that we can make a difference. Look, I could go on for so much longer, Amy. Is that it? Is that the 60 seconds? I can do a little bit more? Okay, thank you. Just in terms of some other themes that really came out in terms of the engagement process for the department's research strategy, the disability community and sector is saying gaps analysis have been done to death. We don't want any more of that. We want strengths-based research. So let's identify what's working really well and let's educate for change. Really picked up on quite a few of the speakers here today where they're saying, hey, let's actually look at community attitudes, let's understand ableism, and let's do some paradigm shifts in terms of that. Another really interesting one was identifying and really enabling those support mechanisms at work, particularly through inclusive education, workforce and service solutions. And finally, thank you Amy, just in the spirit of what we've been talking about with legacy, a really important theme that has come up is in terms of significant shift projects and having that future lens on research. So we need to do the research for now and we need to be thinking about where do we want to be in 5 or 10 years' time and what research do we need to do there. And there's some significant thinking there in terms of regional engagement, in terms of economic disability centres, and look, there are so many other points I could make. That thank you very much for your attention, and Noreen, I'm going to pass back. Thank you.
Thank you so much, Talitha. To continue in that spirit of collaborative partnerships, I would like to invite Julian and Donna to share their thoughts with us.
Thank you. I'm a middle-aged man with grey hair, glasses, wearing a grey suit, who wonders why every time he introduces himself like that, he feels he needs to apologise. I'd like to acknowledge the Bidjigal people, the traditional custodians of the land on which I'm coming from, Sydney, UNSW Sydney. And I'd like to introduce Donna, who's a council member for the National Centre of Excellence in Intellectual Disability Health. Donna is the convener also of the Brisbane Hot Topics Peer Support Group for Queenslanders with Disability Network, and Donna gets to keep me accountable in my role. We've been asked to pair together today to help you understand the role of the National Centre of Excellence in Intellectual Disability Health in shaping a better health system for people with intellectual disability, and the role of research in driving that practice change in clinical services. The way we're going to do that is I'm going to interview Donna, and then I'm going to say some concluding remarks. So Donna, it's great to be doing this with you. Why do we need a National Centre of Excellence in Intellectual Disability Health?
I would like to take you on a bit of a journey to answer the question. It started 40 years ago at a self-advocacy conference in Brisbane. We talked about issues in health, education, housing, relationships and transport. Each year the same issues keep coming up. Not all has changed. On the average, people with an intellectual disability die 27 years earlier than their peers without an intellectual disability. The statistics better known than anyone, Julian. People don't die from having an intellectual disability. People die because they have poor health care. 40 years ago is a long time to wait to make a change. We need to stop talking and start doing.
Absolutely, and it's great to see that you're using research, Donna, in what you're saying. Can you tell me a little bit about what your role is in the centre?
I was elected by my peers to be on the council. As a council member, we work with the staff at the centre, members of the management and others in the disability area. I present the voice of people with intellectual disability and to make sure that they're part of the decision made of the centre. We take it really seriously. The decisions we make directly affect me and my peers. We have to make sure that we are doing it right. Believe me, my peers will definitely let me know if we stuff up.
Absolutely, and you highlight the important leadership by people with intellectual disability in the centre including your role, can you tell us what you think the most important work the centre does for people with intellectual disability?
To make sure that people with intellectual disabilities have a better health care and that the medical professionals understand people with intellectual disabilities. We need to change the attitudes and the conscientious and unconscientious bias for those people who can live in a healthy life and to get the care that they need. The centre needs to support medical professionals to seek people with intellectual disabilities as partners. We need to work together. We are all working together the same goals. Everybody has a right to access quality, timely health care. People with an intellectual disability are no different.
Thanks, Donna. What do you think is the best way to include people with intellectual disability in the centre's work?
Employing people with intellectual disabilities in different roles in different parts of the centre. The centre should showing everybody else how to partner with people with intellectual disabilities. People can be made feel welcome isn't hard. Offering just simply a cup of tea goes a long way. The centre should work with the existing groups and the networks of people with intellectual disabilities. Ask them what they want, listen to them and to what they are saying. Partner with them in sharing the information.
And Donna, in your opinion, how will we know if the centre's been a success?
That is a pretty straightforward question to answer to that, Julian. My peers will always have a smile on their face. People with intellectual disabilities will get the care they need and are living longer, healthier lives. They are partners in their health care. They are respected and they are included. That sounds pretty successful to me.
Thanks, Donna. And those markers of improvements in our system are absolutely central to the success. So I'm going to talk a little bit about the centre. Really, this is a once-in-a-generation opportunity to co-design solutions to the health inequalities experienced by people with intellectual disability. And the context of this work is that over time, a research evidence base has been built that really shows this group is one of the populations in Australia with the most significant health disadvantages of any population group. The centre is essentially one of several components of initiatives funded under a new national roadmap for improving the health of people with intellectual disability. I was fortunate last year to lead UNSW Sydney's bid to establish a consortium-based centre to really drive these changes needed in our healthcare system. On the slide that's showing, you should be able to see the consortium members and a QR code so that you can engage with us and, if you wish, sign up with our newsletter and hear about important events like our upcoming conference next Wednesday and Thursday, where we'll hear a lot about innovation in healthcare for this group. We have 9 consortium members and 56 partnering or collaborating organisations. So this is a very big initiative. Our vision is that all over Australia, people with intellectual disability have good quality healthcare which meets their needs. We think the important work needs to be done in core teams, and we have 4 of those. We have a driving change team which models and delivers leadership in driving change in the sector and inclusion of people with intellectual disability in healthcare. We have a health services development team which is building workforce capacity, establishing communities of practice to develop that professional capacity, working with professional organisations to develop their career pathways for their members, and developing and disseminating information about models of care, as well as investing in innovative models of care for evaluation. We have a resources and innovation team, which is leading the development of an accessible online portal, which we've called a Knowledge Exchange Hub. And we will engage with people with intellectual disability, families and carers, disability and health professionals in a really rich interaction in that exchange hub. And importantly, we have a research and data team which establishes national disability, intellectual disability health research priorities and delivers inclusive research training, research mentoring, and really builds that next generation of research leadership. We'll also importantly be leading the initiatives in the data space related to how we identify and understand the health needs of people with intellectual disability in data systems. And I'm excited to be part of the National Disability Data Asset Council, thinking carefully about how we can do that. When I've taken a step back and thought, how can we make sure that our research is implemented into and made to be a benefit to people with intellectual disability, I'm a firm believer that the co-design must be essentially embedded from the beginning, that the agenda must be set by people with disability, so that we must be responding to the needs of those with lived experience in what research is actually done. I've come from a neuroscience background many years ago into this field, and I understand the importance of mixed methods approaches, not just one approach. I believe that even in university environments, direct employment of people with intellectual disability is critical to the work, and I'm excited that we have many team members now with intellectual disability in each of our teams across our consortium members, including in universities. I think it's important that we think about partnering with relevant stakeholders for the research. This, of course, takes time. It takes building of relationships over time, building of that trust so that people can co-invest in that research and contribute to it. The research must have a strong translational strategy. It must partner with advocates to drive change so that we make sure that use is made of that new knowledge. And we must have a well-defined research and capacity building strategy to build the skills of people with disability to contribute to research and to build the broader research community, especially in our space, which is quite a small one in the research environment. And we must try and secure long-term funding and support through research and institutional infrastructure. This is very difficult. I think we have a history in Australia of underinvesting in disability health research. The centre, I hope, will be driving that research agenda and building that capacity over the next decade as we try and accelerate our progress toward better healthcare for people with intellectual disability. And in doing so, I'm really hoping that we can do our bit to address the systemic neglect in healthcare for people with cognitive disabilities in Australia. Thank you to Michelle and QDM and the conference organisers for this opportunity for Donna and I to represent the National Centre of Excellence in Intellectual Disability Health.
Thank you, Julian and Donna. Across all of our speakers, we have heard about collecting data with purpose, so not just data for data's sake, having genuine curiosity, casting the net wide to ensure that the voices that you're hearing are representative, and actively thinking about the voices that you're not hearing from, valuing the cognitive and emotional labour and the lived experience and expertise of the people that come in to these partnerships, and being genuine about those partnership arrangements in co-design. To finish up, I would like to ask each of our panellists to give us one key insight and one key action that people in the audience, so all of you, both here in person and online, can do right now that will play a role in shaping the next 5 years. No pressure, Kelsey.
Yeah. Look, I think a really key insight for me coming out of Voice of Queenslanders with Disability survey was the community's optimism about the potential for change and improvement following on from DRC and NDIS. I think that optimism might have taken a slight hit recently. And I think what we can hold on to is that people with disability want to be treated with dignity and have their full complements of human rights realized, no matter how that happens or the time frame for that. To achieve that, it's going to be critical that we monitor the implementation of reform, track initial progress and changes to ensure that accountability and that dignity and rights are realized. I think picking up on what Kevin and the rest of the panel have said, really advocating for and fostering an approach to reform that prioritizes nothing about us without us is central to make sure we're embedding the perspectives of the disability community to really unlock impact. And of course, that needs to be occurring across whole of government in rigorous ways. So essentially my key takeaway is to continue the work that so many in this room and online are doing and have been doing for decades, which is really embedding that lived experience within their own corner of practice, work, and advocacy, whatever that might look like, so that we can hold the reform arrangements and structures accountable and make sure that we're creating that legacy of an inclusive and equitable Queensland.
Kevin, you talked before about stories. Would you like to continue with that?
Well, yes and no, but
Whichever you prefer, or both.
look, I think for me, when we talk about co-design, it's got to happen early, and it's got to happen often through the various stages of whatever you're co-designing. And if I can share an insight that TMR, through its latest set of trains, the QTMP, which are starting to enter the prototype, at the first level, pre-procurement, engaged with people with disabilities to talk about what were the key priorities, design priorities of the train to deliver a dignified and valued experience that you'd want to catch the train. So people with disability co-designed the terms of reference for the procurement process. Then once the tenderers were selected to put forward the cases to government, the same group then worked with them to listen to what they were going to propose and then gave them feedback about their proposal. The successful tenderer was the one who listened most intentionally and substantially and authentically responded. And I was out at the prototype, a wooden one, and the NGR problem was they only put one toilet on the train, and because we've got narrow gauges, you can't go past, in a wheelchair, past a toilet. Well, in the QTMP, the interior designer became so passionate to make sure that people, or as many people with physical disabilities in wheelchairs, or parents with twin prams, or people with luggage could go past the toilet, can now go past the toilet on the QTMP train. And that's all as an outcome is because of co-design. And he learned about what people with disabilities needed from a point of dignity and to be welcomed and feel like they belonged on an important part of the way that we get around our towns and our communities.
Talitha, you may not have seen, Amy has been gesticulating to me, so I'm going to rely on your brevity for a...
Might be choosing the wrong person.
Let's aim for it, a real key insight and action, please.
All right, 30 seconds each. Here we go. We are stronger together. We hear it all the time, but it really is true. So I had written down here, there's incredible knowledge to be shared and energy to be involved in robust, co-designed, authentic research processes for impact. So not focus groups, not little bits on the side, but if we're authentic, co-designed, robust, there's huge energy out there for that. A key action right now is please reflect on whether you have an interest and the capacity to be involved in the research process. Understanding research involves us all. That's true co-design. And if you do have the interest and the capacity, then please reach out to the Queensland Disability Research Network and we will connect you with local community networks that we are building to focus on disability research. Thank you.
Julian and Donna, would you care to?
Thank you. Donna, would you like to say something first?
No, I'll let you say it.
Thank you. That's a first, Donna. I think there's two important points. People with intellectual disability are rarely visible, particularly in our data systems. When we look at our data systems that our states and Commonwealth governments use to understand needs, invariably they're incredibly small. They represent only a fraction of the population and don't represent that intersectionality we spoke about before. So we need to design and build better data systems and have a way of entry point to services to identify people with intellectual disability in a way that maintains dignity and that ensures that people can receive the reasonable adjustments they require in services and supports. As well, I think we need to change the narrative. We currently measure in outcomes often it has a deficit basis. We have had, through my colleague Sam Arnold, a program where we've tried to define contribution to society by people with intellectual disability and develop a measurement tool to be incorporated in our dashboards and things like NDIS outcomes. And I think changing the narrative to a strengths-based and contribution-based metric as opposed to a deficit-based would be a really good way forward.
Thank you. I would like to thank all of the panellists today for your insights into how impactful research... Oh, sorry. Sorry, Donna.
That's all right.
Please.
For me, it's a bit hard because everything that I've been involved with, I've been co-designing, but I think the best project I ever worked on is the disaster management stuff, the DDIR stuff, where we worked with a group of people that had intellectual disabilities and we had to learn how to use a communication board. And that's what I am going to take away from the whole stuff that I've been involved in.
So having that opportunity had a significant impact in your own life. Yep, brilliant. Thank you, Donna. So I'm hoping that for all of you, our panellists have helped you to see how impactful research and good data can push the boundaries of what is possible for all of us now and into the future. Thank you.